the odometer. This presentation is for the Spaulding Innovation Challenge. So what is the odometer? It comes from yod, which means hand, and meter, and it's a software paired with an infrared device that allows you to measure range of motion of the hand and velocity at which they move also. Why range of motion of the hand? The range of motion of the hand is essential part of the exam of the hand. The active range of motion is essential to determine motor function, and the passive range of motion requires joint integrity and compliance of the joints. Baseline and serial range of motion provides valuable information such as progress with occupational therapy, action of medications, especially anti-rheumatic or anti-inflammatory medication, progress after surgery, especially in the treatment of joint disease, which can be traumatic or insidious onset from degenerative changes. It can predict outcomes and gauge the benefit of all therapies that are being used. Currently, what's being used is the goniometer, and we're going to talk about that in a second. Each joint is going to be measured individually by opposing the goniometer against the hand, stabilizing the proximal structure, and moving the joint either actively or passively. Doing this for each studied joint of the hand is quite time-consuming and can be uncomfortable for the patient. You also need a specialized healthcare provider, occupational therapist, or a physician to perform this. With the software that we're presenting, the odometer can measure range of motion of all studied joints in seconds and without having to apply the device directly to the patient's hand. So comfortable, quicker, resource efficient, among many other benefits. So who uses the data from the range of motion of the hand? Physiatrists, occupational therapists, hand surgeons, either orthopedic or plastic and reconstructive or general surgeons, rehab centers, rheumatology, since they can track the progress of arthritis with or the benefit with the medications that are being used for arthritis by doing range of motion of the hand joints. So how do we measure right now this range of motion of the hand? We use the goniometer and apply it against the patient's skin. We do each joint at a time. It's uncomfortable. But not only that, it can also it is operator dependent and it's prone to error. As you can see here in this slide, it's very different between the left slide and the right slide, just because of the positioning of the goniometer. It gives us a completely different measurement. Also, as you can see, you have to obviously clean the goniometer after each time. We'll discard it depending on what you're using. You can't really apply if the patient has a bulky dressing. In patients that don't want to cooperate too much or don't have the patience to undergo the whole examination, will get bored and probably upset by doing this whole exam. So this is what we're proposing. You can use an infrared camera. We're using the leap motion and a software that we've created to track the range of motion of the hand. Not only is it useful to get in those values for tracking the progress, but it's also the patient can take the software, can download the software home and take the tracking device, which is only around $80 and see their own progress at home. So comparing the odometer to goniometer, it's quicker, it's not operator dependent, it's easy to use, there's no waste because you don't have to clean the goniometers or throw them out. It's not uncomfortable as opposed to doing the goniometer, which you have to manipulate the patient quite a bit. There's only one model. There's no different type of goniometers. It's just one software. As we said before, no device needs to touch the patient, which can be uncomfortable with the goniometer. And you also collect the data immediately. So when I was having my hand range of motion measured, the occupational therapist had to write down each number. If you don't write down the numbers, then you're relying on recall, and that may create extra error. But if you're writing down each number as you go on each joint, then that obviously takes even more time. And because you're gathering the data right away, you can create graphs to track the progress, which is probably the most useful way of seeing the progress. So the potential for impact, as we said, the eudometer is non-operator dependent, quick, hygienic, and reproducible method to measure progress of the range of motion of the hand joints. And currently performing a range of motion exam takes time from trained healthcare providers, which is expensive, and we want to be efficient. So in a lot of places, the exam may be bypassed, or they choose to one area of interest. With this software, you can do this in a few seconds. You do not require a specialized provider to perform the exam. The data will be stored and comparing graphics, so it provides an immediate visual analysis of the progress or lack thereof of the range of motion. Not only that, this software also provides a new measurement which is not used routinely in clinical practice, which is the velocity of the movement at the hand joints. And this is extremely useful for evaluating tremors, for evaluating dexterity of the hand. Very useful, obviously, in the elderly population, but also patients that require that perform high-speed activities, such as, for example, musicians. And like I said before, the cost of the camera is low, so the patient can actually take a camera and push it at home and use the software to track their own progress while doing home exercises, which will encourage them to perform them. Because there is there's only one model, there is minimal or no inter-facility variability, which means that you can have your exam done at one office or another without having to commute for long periods of time, and you still will get the same result in one place or the other. Obviously, having those numbers is very important, because you're either looking at the progress or lack of progress of the plateau in your range of motion. In some cases, to determine if you're going to continue therapy or not, if it's working, whatever the therapy might be, medication, exercises, massage therapy, or any other intervention that you're using. But also, it's very important if a patient is going to go reconstructive surgery, as you're going to need an intact and freely moving joint if you want to do, for example, tendon transfer or that kind of thing. If you put a new tendon or you transfer a tendon on a finger that the joint is not moving passively, then you're not going to get any motion because of the lack of because of the restriction in the joint itself. Design and usability, it's user-friendly, human-centered design. The software is intuitive to use. Click a button, you have two bars in the top right corner which help locate the hand, and you have tabs which I'm going to show later. And the patient gets immediate feedback by seeing their hand converting to a 3D model. And compared to existing solution, this is definitely revolutionary. And it provides a new measurement not being used before in clinical practice. So how do you use it? And let's see now a short video of how the software works. The software is quite easy to use, very user-friendly. Once you open it for the first time, you're going to have on the right-hand side the visualizer, and on the left-hand side you're going to have the proper software. You input the patient's information so you can track progress if you want to. You don't absolutely need to do that, or you can just create a specific MRN just for this examination. So once you have it, you're going to find there is a couple of things here. Obviously, you're going to have the date of the exam. You're going to have the patient's information. Right now, over here in this area, you would also have more patient health information if you wanted to. Right now it's blocked, but you can have that. In this bar right here, you're going to track you're going to have the timer once you do the exam. It lasts a few seconds. That can be changed also, depending on the settings that you want to use. And you're going to see two bars right over here, which are basically going to tell you where the hand is located, and you want to be in the middle so that you have maximum accuracy as possible. And then you're going to have these buttons, which are active, passive, or velocity. And then you're going to have the tabs on the bottom. The active, you can select right or left hand, and you can also select the wrist position, so you have the most accurate exam possible. Right now I'm going to clear this prior exam that we have right here, and I'm just going to go run a test. So we're going to do the left hand, and I just click start. You see the timer starts to run, and you see the hand here, and I open and close, and the values change. Now this is going to give a minimum maximum range of motion right now. That's the way that it's created the software. But you can also go on advanced and basically get real-time data if you wanted to use that. Quite useful for people that have polydactyly or anything pretty much out of the ordinary that you want to use. Then you can save it, you can plot. Right now we only have one set of data, so it's not going to show us, but you plot here the progress of the range of motion of the hand, and same with the velocity. The velocity is going to give you the speed which you're moving at. So this is all quite very useful. We have our set of data, and then let's say we're going to print it, and we're going to print it in a PDF format. And I'm going to save it, and it generates a table that you're going to see right now. So this can be saved to the patient's chart, printed, given to the patient. You can also track your progress daily if you were to use the home version.